Researchers at the University of Cape Town are conducting a broad, multi-country study on the challenges posed by a rapidly aging population, but also the many challenges faced by the caregivers and the institutional changes that need to occur to bridge caregiving gaps.
We need to think about how we care for older persons. Across the world, different societies are aging. Some are aging rapidly, some are already have high proportions of the population who are older. And in different societies, the needs are different. The care needs of the older population are different. Most families across the region can't pay for care. So we got to think about what can we do to distribute that work a bit more evenly and also recognise that work when it's done, particularly by family members. We've traditionally relied upon family members to care for older persons. First of all, it's not recognised. It's invisible work, and we've heard that before. You know, care work is invisible. Why is it invisible? Why is it not recognised? Knowing that families are the predominant carers in society, particularly in the region, what are the consequences of that? What does it mean if we put a lot of the responsibility, if not all of the responsibility, on families to manage individually in private households very complex care needs? You know, women are the predominant carers. That's the same for children, it's the same for people who are maybe living with a disability, and it's the same for older persons. And most of the time that's a family member, it's not just women. So women are caregiving in both paid capacities but also unpaid capacities, and that they're quite different. So we got to think about what can we do to distribute that work a bit more evenly and also recognise that work when it's done, particularly by family members. Is the health system set up so that it attends to geriatric needs? Not just health needs, though. We have to think beyond that. We also think of care needs. We also need to respect older persons. Older persons have given a lifetime to society, whether it's through, you know, their multiple contributions of helping others, of working, of paying in tax, for example. And we want people to live with dignity as they age. We want people to be able to do what they do, want to do, whatever that is. Some people it'll be to be active, other people it'll to be recognised and heard and to be represented.